Good morning, everyone. Today we will be discussing various tests used to assess lumbar spine pathologies. In this first part, we'll cover 4 specific tests: Lasegue's test, the Slump test, the Brudzinski-Kernig test, and the Hoover test. These tests help in diagnosing conditions related to lumbar spine and neural structures. Let's start with Lasegue's test, which is also known as the straight leg raise (SLR) test. The patient is either lying supine or sitting. As the examiner, you lift the patient's leg off the table to the level of pain. Then lower the leg just below the level of pain and add dorsiflexion of the ankle to stretch the sciatic nerve. A positive test is indicated by pain radiating below the knee, which suggests a disc herniation or neural impingement. Next, we have the Slump test. This test assesses for increased pressure in the neuromeningeal tract or disc pathology. The patient begins by sitting at the end of the table with their back straight and looking straight ahead. The patient then slumps, allowing the thoracic and lumbar spine to collapse into flexion while keeping the head forward. As the examiner, you provide overpressure to maintain this flexion. Next, the patient flexes their cervical spine, and you add overpressure to the cervical spine as well. With your other hand, take the patient's foot into dorsiflexion. The patient then extends one knee. If the patient can't extend the knee, flexion is released from the cervical spine. This process is repeated on the opposite side. A positive test is indicated by radicular pain at any stage. Now let's discuss the Brudzinski-Kernig test, which is used to identify meningeal irritation, nerve root involvement, or irritation to the dural coverings of nerve roots. Ask the patient to lie supine and place both hands behind their head to forcibly flex the head onto the chest. Then, raise the extended leg until pain is felt. The patient flexes the knee to see if the pain disappears. A positive test is indicated by pain in the cervical spine, low back, or down the legs, which is usually sharp and shooting. Finally, we have the Hoover test, which helps to determine if the patient is malingering, meaning not genuinely trying to lift their leg. Cup one hand under the calcaneus of the opposite foot as the patient tries to raise their leg. When a patient is genuinely trying to lift their leg, they will put pressure on the calcaneus of the opposite leg for leverage, which you can feel as downward pressure in your hand. A positive test is indicated by the absence of downward pressure on the foot opposite to the one the patient is trying to lift. In conclusion, these tests, Lasegue's test, Slump test, Brudzinski-Kernig test, and Hoover test, are essential tools for diagnosing lumbar spine pathologies and associated neural conditions. Understanding how to perform and interpret these tests can significantly aid in clinical assessments and treatment planning. Thank you for your attention.